Overcoming chronic pain in the bedroom. And does size really matter? Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Now let's get right to our first question.
Our first question, it has to do with sex, but it's not directly with sex. A man says, I struggle with bad breath and it makes me self-conscious around my new girlfriend. What can I do besides brushing my teeth?
Well, that can be especially tricky when it comes to new relationships. Bad breath can have a number of causes, and it could be as simple as food, like onions, garlic, cheese, or even orange juice and soda. All the food you eat starts to break down in your mouth and gets absorbed into your bloodstream, which brings it to your lungs, and then you exhale the odor along with the air.
You know, you said OJ, orange juice, and soda can cause bad breath?
I know, we tend to think of it as just sweet, but orange juice is highly acidic. It leads to mouth dryness, which in turn leads to bad breath.
Well, I guess I have to find another source of my vitamin C. And what about when it's not food?
Actually, lack of food can cause bad breath when you're not eating. Saliva decreases. Saliva is important because it provides a cleaning action, and without saliva, bacteria grows and then causes bad breath. There are illnesses such as allergies, sinus infections, or even more serious conditions like diabetes and liver problems that can cause bad breath. Another cause of bad breath could be poor brushing and flossing habits, or gum problems such as gingivitis, which is often caused by lack of flossing. I'm bad at it as well, but believe it or not, people with gum disease are 2 to 3 times as likely to have a heart attack or stroke.
Time out, doctor. Heart attack and stroke related to bad breath? Why is that?
Yeah, well, so when you have gum disease, the bacteria that live in your mouth can actually cross into your bloodstream and then enter your heart. There is evidence to show that it can also lead to respiratory conditions as well. Things like COPD, bronchitis, emphysema, or even pneumonia. And there are illnesses such as allergies, sinus infections, or even more serious conditions like diabetes and liver problems.
So what do you suggest they do?
Well, obviously mints will cover up the odor, but they won't get rid of the problem. Chewing sugar-free gum has been shown to increase the amount of saliva, thereby reducing plaque acid and strengthening the teeth and preventing tooth decay. And it's important to note that it's only sugar-free gum. You don't want to keep high sugar gum in your mouth for that amount of time. So if you suspect that the issue might be health related, start with your dentist. They can help you figure out what's causing the issue and help you find a long-term solution.
You know, I know the mouthwash business is a big industry, and I've heard that it's not really good. It dries out your mouth because there's alcohol in them. Can you elaborate on that?
Well, not all mouthwashes actually have alcohol in them, so you can get mouthwashes that are alcohol free. So it really just depends, you know, what you're going for.
Okay, thank you. A woman writes, I have chronic back pain and some days I can hardly move. I've been there. Any tips to be a little more lively and comfortable?
Well, if you're looking to be more lively in the bedroom, consider some of the solutions outside of the bedroom. Try meditation or deep breathing. They both help your body and muscles relax. You could take a class or try it on your own. There are videos on the web that can help you learn how to do these activities. Try to reduce your stress. One way to do that is by listening to soothing music to lift your mood. There's also a guided imagery where you create calming, peaceful images in your mind. Try getting a massage to relieve that stress and tension. Exercise is also good to relieve chronic pain. It can strengthen your back and abdominal muscles. It will also help reduce the risk of heart disease and keep your weight down. But don't do anything too intense or exercise for too long. Also, join a support group. You'll feel less alone and you can pick up tips from others dealing with chronic back pain and find ways to distract yourself from the pain.
You know, I like that advice because a lot of people, the first thing they say, oh man, I'm going to have surgery, talk to a back surgeon. But great advice, Dr. Leah. At least that's a good place to start. Any way to deal with the pain during sex?
Well, missionary is the way to go if you've got any type of spinal mobility issues. That can cause any pain. but the person on top should support their upper body with their elbows as opposed to their hands. Spooning is also great, and surprisingly, doggy style can also be comfortable for people who have back pain, especially with the bending forward motion.
A man wants to know, why can't I last longer? What do you think he means by that?
Well, I'm assuming it's meaning either maintaining an erection or having an orgasm far too quickly. But, if it's just your muscles are fatiguing, I mean, there are muscles that are involved in having sex, and depending on the position or how long you're going, they get fatigued. So that's the easiest way to go. So I'd say strengthen your quads, hip flexors, and abs. But there may be reasons why he's not lasting as long in bed, which is what I'm assuming he means. So there are physical, chemical, and psychological factors that could actually cause premature ejaculation. Just remember, at some point or another, most men experience this feeling. You could be experiencing performance anxiety or stress. There are things that you can do to last longer, but first see if the problem is in fact premature ejaculation. While there is no set time to define premature ejaculation, some professionals say it's anywhere from 2 to 3 minutes. Others define it as 1 minute.
1 minute. Okay. Well, what can they do?
Try masturbating with a sex toy and stopping right before orgasm. Then wait a few minutes and then try again. Medications can help, like selective serotonin reuptake inhibitors, or SSRIs, which can change sexual functioning and may help delay ejaculation. Viagra can also help you regain your erection after ejaculation, letting you possibly continue having sex with your partner. Using a condom can also help by dulling the sensation. There are also numbing creams and sprays that you can apply to the head of your penis that will desensitize it.
So it's kind of like spray and go or type of thing?
Not exactly. You need to apply them about 20 minutes before intercourse and then rinse them off before having sex, because you don't want them to prevent you from actually getting an erection. You also want to make sure that you rinse them off because you don't want to pass off the numbing sensation to your partner.
That's a great advice. Can a partner help?
Yeah, absolutely. Have them stimulate your penis until you're ready to ejaculate and then stop until the urge decreases. You want to repeat this 3 or 4 times and then ejaculate on the 4th or 5th. Another technique to try is called the squeeze method, where you or your partner stimulates you until you're close to climaxing. Then tightly squeeze the penis without stimulating. That should cause your erection to weaken slightly. Try breathing deeply in and out as you ejaculate. Or visualize something not related to sex when you're close.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Still to come on Sex Talk. Improving your prostate health. Taking it to the streets. Long-distance relationships.
For men, the prostate typically grows with age, and that could cause problems. Here are a few tips to reduce your risk of prostate issues.
Prostate health is important for men of all ages. The prostate is a gland located below the bladder and in front of the rectum. It produces fluid that makes up sperm. As men age, the prostate can become enlarged, leading to a range of uncomfortable symptoms. Here are some tips for improving your prostate health. First of all, eat a healthy diet. Eating a healthy diet that is rich in fruits, vegetables, whole grains, and lean protein. Avoiding processed and high-fat foods can also be beneficial. Exercise regularly. Regular exercise can help improve prostate health by reducing inflammation and improving circulation. Aim for at least 30 minutes of moderate exercise, such as brisk walking, cycling, or swimming, most days of the week. Be sure to stay hydrated. Drinking plenty of water can help flush out toxins and reduce the risk of urinary tract infections. Limit alcohol and caffeine. Drinking excessive amounts of alcohol and caffeine can irritate the bladder and worsen prostate symptoms. Get regular checkups. Men over the age of 50 should get regular prostate exams to screen for prostate cancer and other potential problems. Early detection is key to successful treatment. Taking steps to improve your prostate health can help prevent discomfort and reduce the risk of serious problems.
And you need to know the signs that indicate something may be wrong. If you experience painful or frequent urination or even blood in your urine or semen, talk to your doctor. Still to come, we dig into the side effects of sex pills. Plus, we answer the question most men want to know: does size really matter?
So what is your go-to pickup line?
Yeah, that's him.
For me, I would just, which I did say to him, I want to kiss you.
Oh, okay.
Or,
There we go. It's right to the point.
Right to the point.
Something
And I was
that.
like, please.
What
I
would you
hate
say?
pickup lines. I think they're so cheesy. I think it's natural. I'm natural and very honest, so
honesty
I'm a
is your
straight
pickup
shooter.
line.
Yeah.
Yeah.
Well, that's
I'd
nice.
like
I
somebody
like
that's
it.
a straight shooter with me.
You can't think of one? Oh, no pickup lines. Not even like a look.
It's a high.
Hey, that's
He's
how
got the smile. That's his thing.
I like it. That's how I picked up my husband. Hi, I'm
Can I
Leah.
get-
How would you know when you found the right person?
It's a vibe. It's a chemistry. It's just you feel it.
I think someone you just like naturally, like someone you can talk to like for a while. Yeah, you just click. You don't really have to think about the next thing you're gonna say. It just kind of flows naturally.
And someone that my mom likes too helps.
Oh, I can feel it right away. I can look at the man and I can already tell if he's the right one or he's not, you know?
Like that right away? Just what even?
Yeah,
Really?
like
I
that
think
doesn't take
it's a
long.
lot of common like together, so you just feel it like it's your person, you know.
I would say you kind of just have to take a leap. And if it's the 80-20. If you can love someone for 80% of what they're worth and a little bit more and deal with the 20, I think you got something special.
Oh, I love it.
Good deal.
Same?
Yeah, pretty much the same. I mean, I think, you know, when you're during that time where you kind of like fall in love, you think like, you know, I love this person more than anything. So that's when you kind of know.
Back here on Sex Talk, let's take some more questions from our viewers.
Thank you, Dr. Leah. A woman asks, is lube safe during pregnancy?
Yes, your cervix is tightly closed during pregnancy and it prevents things like lubricants from getting through to the baby. Make sure the lube you choose is pregnancy safe. So you want to choose ones that avoid glycerin or parabens or fragrances because they can be irritating.
What else should they look for?
You want to get one that's water-based because unlike some oil-based lubes, you won't run the risk of having an altered microbiome that could cause some bacterial or yeast infections. But coconut oil is the exception because it can help prevent both yeast and bacterial infections. Using lubes can also help with vaginal dryness, which will make having sex more comfortable.
And Dr. Leah, any other lubricants they should avoid?
Well, you want to look out for additives that make you feel hot, cold, or even tingly. Even though they're supposed to enhance pleasure, they can sometimes have strong and painful effects on the tissue of the vagina that happens to be a little more sensitive when you're pregnant. Look out for flavored lubes that contain sugar, because that could increase your risk of getting a yeast infection because it kills all that good bacteria.
A man wants to know, are sex pills bad for your heart? I don't know if he's asking about the blue pill variety or I'm not sure.
Well, yeah, exactly. So it depends on what you mean by sex pills, right? So the PDE5 inhibitors, which you're thinking of the blue pill, that's your Viagra, Cialis, Levitra, you know, those are not going to be bad for the heart. In fact, they can actually help the heart. But people go crazy with supplements. And I have to give a little disclaimer here. Like, I'm a big advocate of supplements. I take supplements. I am sponsored and certified in sports supplements. So there's nothing wrong with it. But people will avoid pharmaceuticals for supplements because they just think like, oh, it's all natural. When the reality, pharmaceuticals have gone through clinical trials. So I'm not advocating for them, but don't think that because it's a medication and it's a prescription that it's automatically bad. At least you know that those have been rigorously tested. So anyways, all of those really can help the heart and can be used in conjunction with antihypertensive medications. But it may be an issue if you're on alpha blockers. So if you're taking any over-the-counter sexual enhancement pills, notice that they're unprescribed and they're unlicensed supplement. And most of them will give you that energy rush and increase blood flow overall, may increase blood pressure. They might help with an erection, but they may also be really bad for your heart and other organs as well. Plus, they can leave you with some nasty, unwanted symptoms such as headaches, stomach aches, and nausea.
So, let me get this straight. So, supplements are bad for you?
Well, no. And like I said, I'm an advocate of supplements. Not all are bad. Some, like maca, are really safe. There's others like red ginger and saffron, which are relatively safe and can help enhance sexual function. But they too can also cause some digestive issues, irritation, dry mouth, increased heart rate. So they will keep you up. I've seen that a lot as a side effect. Any nausea, vomiting, diarrhea, any of these unwanted side effects do happen in some people. Plus, there are very rare instances of liver and kidney problems.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Still ahead on Sex Talk. Long-distance relationships. Sexual positions to help with ED. Regaining desire after menopause. Does size really matter?
Long-distance relationships can be tough, but we have a few ways couples can navigate the challenges and strengthen their relationship.
Whether you're separated by miles or oceans, long-distance relationships can be challenging. Here are some tips for maintaining a strong relationship while you're apart. Communication is key. In a long-distance relationship, communication is even more important than in a traditional relationship. Set aside time each day or week to talk, whether it's by phone, video chat, or messaging. Be open and honest about your feelings and make an effort to stay connected. Make plans for the future. Having a goal or plan for when you'll be together again can help give your relationship a sense of purpose and direction. Whether it's planning a future visit or discussing a long-term plan for being together, having something to look forward to can help keep you motivated and connected. Get creative with communication. In a long-distance relationship, it's important to find creative ways to stay connected. Send care packages, surprise each other with thoughtful messages or gifts, or watch a movie together over video chat. Finding ways to keep things fresh and exciting can help prevent the relationship from becoming stagnant. Trust each other. Trust is essential in any relationship, but it's especially important in a long-distance relationship. Be honest with each other and don't let jealousy or insecurity get in the way. Trusting each other can help build a stronger connection and make the distance feel less daunting.
And when you're together, make the most of that time. Now let's take on some more questions.
Dr. Leah, a viewer asks, can changing sexual positions help with erectile dysfunction?
Yes, there are some positions that can help enhance your sexual experience. One of the best is doggy style. You can speed up or slow down the thrusting of your penis while using your pelvic muscles. It allows the blood flow easily to the penis and can be visually exciting. Another good position is reverse cowgirl, with your partner on top and facing away from you. You can hold your partner and help position them to provide more friction while you use your pelvic muscles. This position helps you stay relaxed and support strong blood flow.
What else works, Dr. Leah?
Well, another position is where your partner is also on top but facing you. This allows you to watch the penetration that can enhance your visual stimulation. Spooning while you and your partner are lying next to each other, with your partner in front, is also a great position for ED.
This viewer asked about positions, but is there anything else that can help?
Yeah, aside from sexual positions, there are some other things you can do to improve your sexual performance. Practice a healthy lifestyle, no smoking, limit the alcohol use, and of course exercise using all of your muscle groups, especially those pelvic muscles.
And exercise is the key to everything, actually.
It absolutely does. It gets your blood flowing. It is helping the endorphins, and helping reduce cholesterol, which can also, high cholesterol can also lead to ED. So there are a ton of things that exercise helps with.
Excellent. Dr. Leah, a woman writes, I've always been hot for my still hunky husband, but after menopause, I just don't have any desire. What can I do to get that butterflies in my stomach feeling again?
Well, many women feel that they lose their desire for sex after menopause, which is understandable because of the hormonal changes. Estrogen decreases, which can cause a series of negative issues, and sex drive may just be one of them. Getting those butterflies back may take a little work, but it is definitely worth it. First, you may want to speak to your doctor about hormone replacement therapy, or HRT. There are many different forms. You could either insert a tablet directly into your vagina, plus there's also a vaginal ring that releases a low dose of estrogen over an extended period of time. This will also help if you're experiencing vaginal dryness due to menopause.
How can the husband get involved?
Hey, then she should absolutely speak to her husband about how she feels. Tell him you still love him and that you still find him attractive. Discuss things that you could do to enhance the sexual desire. You could try spending more time with him, more time foreplay. Ask him to apply the lubricant and, tell him to take his time while doing it. Also, planning an intimate evening where you wear something that will make you feel sexy is a great way to start. You want to just get creative where and when you have sex, or try different positions or incorporate sex toys. Ask him to suggest some ideas that he thinks might turn you on.
Great advice. Thank you. A man wants to know, it's $1 million question, by the way, does size matter to women?
Well, more men get caught up with this than women do, right? For most women, good sex is more about performance than size. So if you worry too much about the size of your penis, it really could lead to a loss of self-esteem and erectile difficulties, and that could actually lead to other sexual performance problems. So it's better to spend more time on focusing on being relaxed and enjoying the sensations you experience, like making love to your partner.
A very safe answer. I appreciate that, but most men still want to know, does size matter?
Well, it looks like you're not letting me off the hook on this one, so I'm going to go back to the research. According to studies, 85% of women were satisfied with their partner's penis size, as opposed to only 55% of men who were satisfied with their own size. In another study, 91% of women did say that size matters for sexual satisfaction, but girth was actually more important than length. Every 8 out of 10 women would actually prefer a man with a thicker penis over a man with a longer but thinner penis. The vagina of a woman is, fairly shallow, right? A thicker penis is good for stimulating the clitoris, but men typically aren't thinking this way. When they think of size, they're typically measuring length. But remember, bigger isn't always better. More than 83% of women found that some penises are too big to be satisfying. Well, Derek, that is all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to know on Sex Talk.